All right, in our next assessment, we're going to take a look at your passive range of motion on internal and external mobility of your hip. And then we're going to see the active range of motion as well, compare the difference to see if it's going to be more of a mobility restriction or a stability restriction. So let's go ahead and have you lie on your back. We'll do right leg here first. So I want you to be as passive as you can. So we're going to bend the knee, try not to assist or fight me on this. Definitely let me know if there's any pinching, any pain. What we're going to look at first is internal rotation of the hip. So I'm just going to see what we get. Applying a little bit of pressure. Again, trying to let Aaron relax into this stretch. Any pinching, any pain?
Tightness, but not pain.
Okay.
That's awesome. A little pinchy.
Yeah, so I think that's about it there. So if we look at not really having a goniometer here, if this was 0, we are probably around a 45 degree, maybe 35, 40, somewhere in there, which is not bad. Now let's take a look at the external. And again, let me know if there's a hard stop or any pinching pain. This one's looking a little bit tighter. About there. Okay, so again, goniometer, this one's probably closer to 25, maybe 20. So if we kind of consider that range that we have here too, can we improve that entire window? We'll see. So now let's take a look at the right side. Okay, internal first. What I'm looking for here is any kind of compensation in the hip. Say if we do a hip hike, which Aaron's doing really good at being passive here, we get quite a bit more range on this side. Again, let me know if there's any pinching, any pain, but awesome. I'd say this is closer to like 65. Quite a bit more on the internal. External is usually going to be fun if that's that much more. And I could already feel that shift. Your whole body's moving.
Yeah.
So a couple things. I'm supporting at the knee, supporting at the foot, trying to get it as passive as we can. And then again, just spending a little bit of time towards end range just to see if there's any chance that Aaron can relax into this a little bit more. But if I'm noticing the body's moving, we're tensing up, hip hiking, then we're just going to call it there. And then again, just kind of using that imaginary goniometer, probably 10, 15 degrees on that one. So it makes sense. The total window is similar, but you're just getting more external or internal on this one than you are on the other side.